is a Department of Health initiative to give the public more choice of when, where and how their healthcare needs are met. This means offering the public a choice of alternative hospitals, improving the flexibility of public services and making the NHS more patient-centred. In this programme, we showcase hospitals leading the way with initiatives that will make an impact on the care given to patients. These hospitals have clearly demonstrated that the patient is their #1 priority. We visit the University Hospital of South Manchester's Cardiac Surgery Centre, where survival rates are in the UK's top 5. The Trust's Wythenshawe Hospital is one of only a handful of centres to achieve better than expected survival rates of almost 98% for heart surgery patients. The NHS is increasingly benefiting from the improvements that management consultants can bring, like greater efficiency, increased productivity and a happier workforce. But what KM&T has to offer is unique. The firm employs professionals who are trained in the Toyota business model. The result? Improved patient care and reduced operational costs. We visited University Hospitals Bristol to find out more. We visit Guy's and St Thomas's NHS Foundation Trust in London, who have converted all of their hospital wards to disposable curtains, with the added protection of the residual biocide that kills MRSA. We talked to hospital staff and DCCL, Disposable Cubicle Curtains Limited, the makers of the superbug-resistant curtains. Patients that need to go to hospital to see a specialist have the right to choose which hospital they're referred to by their GP. This legal right allows them to choose any hospital offering a treatment that's suitable and meets NHS standards and costs.
The University Hospital of South Manchester has become renowned for its cardiac services, as it provides some of the most advanced state-of-the-art medical and clinical interventions for cardiac patients. We have one of the few transplant units in the country, we have an extensive programme of surgery, and we have some of the most innovative and advanced cardiology techniques happening today. We're at the leading edge of innovation and practice. We're operating on patients now who previously would never have been able to benefit from these procedures. And we have brand new state-of-the-art facilities in the Northwest Cardiac Centre which give people access to some of the very best facilities while they undergo major life-saving operations, where they undergo techniques that will add years to their lives, and where we have some of the most skilled and successful clinicians available in the United Kingdom.
We have a team which encompasses people who are specialists in a number of different areas of cardiology. We have 6 cardiac interventionists, 3 or 4 interventional electrophysiologists, and specialists in cardiac imaging. So the team is unusual in that it's a big team and it's a functional team. We get on extremely well with each other, and communication is extremely strong. We had a vision of trying to develop a new heart centre here. We have a state-of-the-art coronary care unit where the building itself is really divided into 2 areas. One is a state-of-the-art critical care facility for cardiac surgical patients, bringing together what was known as high dependency and intensive care. And on the ground floor is an outpatient department and a cardiac diagnostics area. We've incorporated also on the ground floor a cardiac MR facility, which is the finest in the Northwest, which brings a new dimension to the sort of imaging facilities that we've got. And it adds to the brand of UHSM in terms of saying that it is one of the foremost heart centres in the north of England.
The Ticker Club is an association of former patients, cardiac patients at Wythenshawe Hospital, formed 21 years ago by former heart patients who felt they wanted to give something back. Since then we've been raising funds and providing patient support. We're fairly unusual in that we do all of those things, both visiting patients on the wards on an almost daily basis. we can put across to them how we came through the experience, how they're in good hands here, and what the likely outcome is, which for heart patients is with cardiac conditions which require surgery or angioplasty, the outcome percentages are incredibly high. 95% of us have a good experience and come out of it better than before. And obviously everyone who comes in for an operation is worried to some degree, and we can talk to them from their point of view about what it feels like to come out the other side.
Some time ago, the Department of Health decided that patients were waiting far too long to receive treatment. So what we've done is built on the success of the Rapid Access Chest Pain Clinic, which has been a national drive from the Department of Health, and added in one-stop services for patients with breathlessness, so they can come to the heart failure clinic, with palpitations, so they come to a dedicated palpitation clinic, and to rapid access into general cardiology. That means that if a patient is programmed into that, we can anticipate, based on the referral, that they will need certain types of investigations at the time of coming to the clinic, and we can arrange that as part of a one-stop. For patients that are coming through to elective clinics, we can respond to a letter in advance and often have investigations completed before the patient comes to the outpatient clinic to see the consultant or the registrar. So it cuts out the unnecessary waste and duplication of visits and patients having to come many times for the same thing.
For the last 7 years, the results after heart surgery here at Wythenshawe Hospital have been better than the national average. And during the last year, just to give an update, if you have first-time coronary artery bypass graft surgery here at Wythenshawe now, you can expect a mortality, a death rate of less than 1%. That's what it currently is in the last 12 months. The mortality for all heart surgery is currently less than 2%.
I had a quadruple bypass, and within a few weeks was feeling hugely better. I felt that in my experience, it took about 3 months to get over the operation and 4 months to forget about it.
These sort of results after heart surgery can only be achieved when the whole team is working optimally. And the team includes nursing staff, anaesthetists, cardiologists, surgeons and intensive care doctors, in addition to hospital managers. And in order to achieve the very best results, the whole team needs to be functioning optimally. Here at Wythenshawe, we strongly believe that patients undergoing heart surgery should be operated on by surgeons with subspecialist interests. So, for example, here at Wythenshawe, we have surgeons who are specifically interested in mitral valve repair surgery. We have surgeons who are specifically interested in complex aortic valve and surgery for aortic aneurysms. And we also have surgeons who specialise in surgery for heart failure, including heart transplantation.
I had a rather bad chest infection, and the doctor sounded me and she said, "There's a little noise there," and they found a sticky valve. You see, instead of having the big open heart surgery, it's done by keyhole, which is a marvellous thing. I've been so comfortable that you're put at ease all the time. You're really put at ease. There's no pressure, and everything's explained 2 or 3 times, so you've no pressure.
We have a newly developed cardiac magnetic resonance scanner, which is on the ground floor of the heart centre. And in the same way as patients who have problems with joints or their brain would routinely be referred for scanning, this new technique, which has been applied to the heart, is extremely helpful in terms of patients with cardiac problems. Other techniques of imaging often involve quite large doses of radiation. This involves no radiation at all, so patient risk is minimal, and the images that are created are extremely futuristic and very helpful in terms of planning treatments.
If I were recommending any patient, wherever they lived, towards a hospital, I'd have no hesitation in pointing them in the direction of University Hospital of South Manchester.
It's been wonderful. I've never felt so well for a long time.
My final message to those people who are looking at patient choice is that the University Hospital of South Manchester offers a great choice for patients, both in terms of access, facilities, but first and foremost, the expectation of high quality treatment and care. And certainly every patient who comes to us should have confidence in our ability to deliver a successful and effective clinical outcome.
The NHS is increasingly benefiting from the improvements that management consultants can bring, whether it's greater efficiency, increased productivity or a happier workforce. But what KM&T have to offer is unique. The firm employs professionals who are trained in the Toyota business model. The result? Improved patient care and reduced operational costs. We visited University Hospitals Bristol to find out more. Toyota's production line in Toyota City. This car manufacturer has started a worldwide revolution in the way many businesses are run, based on simple principles and an integrated approach. But can the principles of running a high-tech factory in Japan have any relevance to the complexity of the NHS? Well, they do at University Hospitals Bristol, where KM&T have been working to improve patient outcomes and operational effectiveness.
What KM&T bring is they can work with all staff at all levels in exactly the same way. They're very non-judgmental. They're here absolutely to help improve the services for patients and the staff working lives, but they recognise that our staff are the experts in providing patient care.
Using the philosophy of lean and the principles of lean and the tools associated with that philosophy, it's possible to break complicated processes, complicated systems down into very, very transparent and easy to understand processes. The Toyota model transfers and fits very well with the NHS. Toyota model is all about pleasing and exciting customers and looking after your customers in terms of safety, reliability and quality.
KM&T has developed several national improvement programmes in partnership with the NHS Institute for Innovation and Improvement. The company works with over 25 NHS trusts and is now increasingly taking on primary care trusts and strategic health authorities. At University Hospitals Bristol, lean methodology has already significantly improved services in the eye hospital and the gynecology department, among others. The trust is now embarking on a whole hospital approach, looking across services and total patient pathways.
I thought the support they gave was absolutely fantastic and has helped us achieve all the things that we want to achieve, but also has meant that I, as a clinician, can apply some of those principles to other things that I want to do. So it's a continuing process. It's not just been this project and stop.
The pharmacy at University Hospitals Bristol has also welcomed the Lean project to help speed up the processing of prescriptions, which in turn has enabled doctors to discharge patients quickly. The department has introduced the standard of 2 hours. That's 2 hours from when the prescription arrives at the pharmacy to when the medicine is handed to the patient. Now, thanks to the Lean project, it's achieving a 70% success rate. That's up from 28%.
It's involved everyone, it's got the engagement of all of the staff, morale is better, our looking at processes are better, and we're measuring what we're doing and we're showing what we can do to the hospital management.
Key to the success of Lean is the fact that it's a whole organisation approach. By analysing processes and workflows and removing those that are not productive, the team will create new ways of working that benefit both the patients and healthcare workers at all levels.
I believe most sincerely that we have to use lean methodologies on the patient pathway to get the best outcomes. We've now got a queue of people volunteering their teams to go through the lean process. One thing that's important for me to say is that we're in this for the long term. We can make short-term changes and show a remarkable turnaround in our fortunes, which we've done. We think we're now good. We want to be among the best.
Patients can now choose a hospital according to what matters to them most, whether it's location, waiting times, reputation, clinical performance, parking facilities, or patients' comments.
My role at Guy's and St Thomas's is Deputy Director of Infection Prevention and Control. That gives me responsibility for developing the strategic approach for reducing the risk of infection to our patients and managing the day-to-day situations to ensure that we're able to respond appropriately to any cases of infection which arise and any larger scale problems which should materialise in our day-to-day working. We introduced disposable curtains at Guy's and St Thomas's probably 3 to 4 years ago in a trial to look at enhancing the facilities within our intensive care units. The curtains were found to be very successful in terms of the user operator, and as a consequence of that we've adopted them across the organisation. The main benefits that we see from having disposable curtains is the ability to handle them, the health and safety of the staff who are handling them, and the ease to change them as and when we require to, rather than being reliant upon teams having to come in on a pre-planned basis. If we're looking at introducing curtains as part of the General Environment Award, we cannot wait for contaminated items to be changed by a delay of many hours. It is essential that we're able to change them at an early opportunity, and for the general staff on the ward to be able to do that themselves rather than waiting for specialist teams.
Disposable cubicle curtains, DCCL, are the leaders in the field of disposable curtains for the NHS. We have been going for some years now developing hospital disposable curtains that can be used in the hospital environment. We have patented an EasyFit curtain, and our EasyFit curtain can be hung in under a minute on virtually all existing hospital tracks. This curtain not only has the benefit of being a bright and pleasant environment on the ward, but it does also kill MRSA, and we've got exhaustive tests and proof that it does the job we say it will.
Camden BRI are the world's biggest research-based institute. We conduct testing on all areas of analysis such as chemistry, microbiology, hygiene, and it's the area of hygiene that's seeing us working more now with the healthcare industry. After meeting the people from Disposable Cubicle Curtains Limited, we actually talk through the test methods we believe they should conduct to prove that their product had the antimicrobial claims they believed it had. So we supported them with regards testing the actual coating in its liquid form to show that it was effective as a disinfectant using approved European standard test methods, and this we did. And then we moved on to testing it as a treated curtain to show that once the disinfectant chemical was used to treat the actual curtain material itself, they also had antimicrobial properties.
The testing by Camden BRI is fundamental to demonstrating the value of the antimicrobial coating that is on the curtains that we are employing within this trust. That gives us the assurance that not only do we have a good product, but one which has antimicrobial properties which will inhibit microbial growth and play a part in reducing the risk of cross-contamination between patients.
We basically put the curtains in direct contact with 3 chosen microorganisms from the healthcare environment. We did E. coli, MRSA and VRE, and we found that all 3 were susceptible to the antimicrobial coating on the disposable cubicle curtains. So basically saying they were susceptible and inhibited by the actual presence of these material in direct contact with the organism. And we also found that 6-month-old curtains were also antimicrobial against MRSA.
I actually started in this hospital, Guy's and St Thomas's, 16, 17 years ago, when all curtains were durable. And to tell you a little story about one Christmas Eve when we had a patient that was very ill on one of the wards and we couldn't actually get the curtains to pull across. And that sowed the seed in my mind that we've got to do something about this, to standardise the type of fitments that we use, the type of hooks that we use, but more importantly to standardise the actual curtain. And that's when I went on a mission to try and find something to adapt into this hospital to make dignity and respect in this hospital at the forefront. I was approached about the disposable cubicle curtains about 4 or 5 years ago, and it just lit up in my head that this is something we've got to go with.
Being awarded the Queen's Award for Enterprise and Innovation was possibly the height of what we could have achieved. We had invented a new product that we'd entered onto the market, which we'd patented, and the patented EasyFit curtain, which was recognised for its ability to fit to virtually every existing hospital track, saving money and saving time, was what the award was all about. It was the greatest honour to be presented to the Queen at Buckingham Palace.
Time is very precious in a hospital, and whereby it used to take us hours to change a set of curtains, it now takes 30 seconds, and that frees up time to deliver patient care, because that's what we're all about, the delivery of patient care.
For the patient, I think the use of disposable curtains means improvement in the visual impact of the environment to them. The curtains are obviously clean, the patients can see them being changed on a regular basis if it's necessary, and the fact that they are bright colours also probably enhances the visual impact they make within that environment.
We have strived over the last few years to produce a product that will not only make hospital environments look good, but also kills the threat of MRSA and the opportunity of passing it on between patients and staff. All curtains in hospitals have to be treated with a fire retardant. It is the law, and our curtains are tested to the highest level of NHS requirements for fire retardancy. But what we've managed to do is include a residual biocide. The residual biocide's quality kills MRSA, E. coli, VRE and Enterococcus horari, and other bacteria that are found in hospitals. This is a complete revolution and what stands us apart from the rest of the hospital curtain industry and even the disposable curtain industry.
The developments in infection prevention over recent years has moved significantly from a situation whereby we relied on the basics to reduce risk of infection to looking at whole system change to reduce the risk. To have a product which has an added benefit through antimicrobial activity directly relating to clinical practice is part of the innovation programme that we're seeing coming through the National Health Service, and to have a product which is able to demonstrate its value through appropriate testing is essential. It is important that we recognise those products that go the extra step to demonstrate their value rather than making claims which are unsupported.
The evidence is there that the product inhibits the growth of MRSA, E. coli and VRE.
You've heard from NHS representatives, you've heard from Camden BRI, who've done rigorous testing of our products. We at DCCL are proud to be playing our part in the fight against hospital-borne infections.
There are many reasons why you might prefer one hospital to another. Evidence shows that if you choose a hospital in which you feel more comfortable and confident, you're likely to improve both the result of your treatment and your experience whilst you're in hospital. I'm Georgina Burnett and you've been watching Hospital Choice, Patient Choice.